The healthcare system that you're saying sucks is Obamacare. We told you this would happen.
Shit. She got us, you guys. How do we put this in terms that they can understand?
And which plan do you support? Obamacare or the Affordable Care Act?
The Affordable Care Act.
And what is it about Obamacare that you do not like?
I just think that there's a lot of holes in it, and it needs to be revamped. I think
And you think
hasn't been thought out.
You think the Affordable Care Act is a better plan than Obamacare?
Better, but I'm not happy with that either.
What do you agree with? Obamacare or the Affordable Care Act?
I'm more towards the Affordable Care Act, but I'm also very sympathetic for people that don't have the ability to have proper medical insurance.
So the Affordable Health Care Act is still a better option than
Yes.
Obamacare?
Yes.
Do you support Obamacare or the Affordable Care Act?
Affordable Care Act.
And why is that?
Well, I mean, I'm not the biggest fan of Obama, so I don't support him in the Obama things that he's got going on. I'm actually really excited for President-elect Donald Trump, so.
Right. So you don't like anything Obama does, and you prefer the Affordable Care Act.
Absolutely.
Do you support Obamacare or the Affordable Care Act?
I support Obamacare.
So if you were a senator and you could vote today, you would vote to keep Obamacare instead of the Affordable Care Act?
Yes.
Do you support Obamacare or the Affordable Care Act?
I guess the Affordable Care Act?
And why do you prefer the Affordable Care Act over Obamacare?
I'm not really sure. My girlfriend supports Trump, so I go with whatever she says.
What is the main difference between Obamacare and the Affordable Care Act?
One is you pay, and then the other one is Obama pays for you.
Right, Obama pays, pretty big difference.
Pretty big difference.
I believe that Obamacare, the premiums are too high, so people end up paying more.
Right.
So I believe in the Affordable Care Act.
And so the Affordable Care Act is more affordable than Obamacare?
Right, correct.
Right.
Which is obvious based on the name.
It's in the name, right?
Right.
Why do you like the Affordable Care Act more than Obamacare?
Because I don't like Obama.
But you like the Affordable Care Act?
Yeah.
What if I told you Obamacare and the Affordable Care Act are the same thing? Do you agree with the Affordable Care Act or Obamacare?
The affordable.
And why do you prefer the Affordable Care Act over Obamacare?
I just don't agree with the whole Obamacare policy thing that's going on. I just don't agree with it.
And do you believe that an informed citizenry is essential to a democracy?
Yes.
So you disagree with Obamacare?
Yes, I do.
Do you think insurance companies should be able to exclude people with pre-existing conditions?
No.
Do you agree that young people should be able to stay on their parents' plans until they are 26?
They should be able to, yes.
Do you agree that companies with 50 or more employees should provide health care?
I do.
And so by that logic, you would be for the Affordable Care Act?
Yes.
What plan do you support, Obamacare or the Affordable Care Act?
The Affordable Care Act.
And why do you support that over Obamacare?
Do not like Obamacare. I don't like anything that has to be forced for everybody to buy. This is not good.
Do you think Obamacare is socialist?
Yes, I do.
Do you think the Affordable Care Act is socialist?
No.
Do you believe that Obamacare will eventually lead to gun prohibition?
Yes.
Do you know that Obamacare and the Affordable Care Act are the same thing?
Hold up. Y'all actually didn't know Obamacare and the Affordable Care Act are one and the same? Y'all made up the name. Y'all made it up. Y'all started calling it Obamacare. Like, it had a name first. The name has always been the Affordable Care Act. Then y'all named it Obamacare. Did you forget? See, this is how I know y'all just hating indiscriminately. Y'all don't even know what y'all be hating. I'm gonna go out on a limb and say he was black. That's what y'all do like. Why y'all ain't just look it up? Why you ain't just look it up? I guess so. Y'all crying on the internet talking about your health care is about to be taken away and you don't know what you're gonna do. But when that man said he doesn't have a plan, he has a concept of a plan for health care. Why did that scare you? Why did that scare you? Oh, nah, y'all are stupid. Oh, y'all need to be studied by people who are not stupid. You know, like those people you didn't believe during COVID, the scientists. That was the word I was looking for. Ooh, shit, sorry. The stupid almost caught me just now.
All of these Trump voters admitting that they didn't realize that Obamacare was the Affordable Care Act when they vehemently hated Obamacare is one of the most openly racist things I've ever seen in my life. Like, I don't understand how they don't have the critical thinking and the thought process to just know not to say that out loud because of just how simply racist it is that they were so against Obamacare just because they associated it with Obama, which was the point. That's why Republicans coined Obamacare, so that racist people would hate it without understanding what it was. And that's exactly what they're admitting happened by saying they hated Obamacare and they thought Trump was going to get rid of Obamacare, but they have the Affordable Care Act and they didn't realize they were the same thing. I don't wish that they would keep it in, but it's insane to me that they don't have like the maybe 2 or 3 step thought process that tells them don't share that out loud because you are self-exposing that you are super racist.
Obamacare was not a disaster, and I really wish y'all would stop spreading that lie. And it's got to be because either A, you're too young to remember what the financial market and environment looked like back in like 2006, 2008, or you got a very short memory. I entered the workforce back in 2006, the same year I entered college, and the minimum wage was $5.15 an hour. Maybe 1 or 2 years after that, it was $6.55 an hour. At $5.15 an hour, $6.55 an hour, you were not getting insurance through the company. I remember that vividly. That premium was going to at least eat up 1 week of your check, and you only making $200 a week anyway. And you for damn sure wasn't going to get it privately because the premiums are even higher. This is why people back in the day told y'all, get a job with the post office, get a job with the city, get a job with the state, work for the government. Why? Because you may not get rich working for the government, but them benefits are going to make sure you're taken care of. But if you want to know the value of the ACA, you can just look at the benefits they celebrate. Do you know how many people were denied coverage due to pre-existing conditions? Do you understand how many people had the prices of their insurance jacked up just because they got sick? Y'all are harder on this legislation than y'all are on the companies that cause need for legislation. High premiums existed long before the Affordable Care Act. High deductibles existed long before the Affordable Care Act. Medical debt definitely existed long before the Affordable Care Act. In fact, medical debt has always been one of the leading causes of bankruptcy in the United States. The Affordable Care Act was originally meant to be a step toward universal health care. The problem is nobody else has taken another step to actually accomplish the goal of universal health care for citizens of the United States. Y'all gotta start doing some research on your own instead of regurgitating these talking points that are completely unfounded.
Right behind me is the world headquarters of Centene. Now, Centene is one of the largest healthcare providers in the United States that you may never have heard of. That's because they represent healthcare plans on the ACA. And today, the company announced that they're offering voluntary buyouts in order to help cut costs. In the first quarter alone, Centene lost 2 million ACA members, and their executive leadership expected to continue to decline throughout 2026. And what's one of the reasons why 2 million members have fallen off of plans at Centene in just the first quarter? Well, the Trump administration allowed subsidies to expire, and many Americans can't afford these healthcare plans. Right now, Centene is allowing employees to apply for this voluntary separation program. However, reports indicate that if not enough people take it, layoffs will be coming. With 61,000 employees, it's a big reminder that policy decisions in D.C. have rippling effects across this country. And of course, it wouldn't be me without saying this, but I still can't believe that this company would make a $50,000 donation to Donald Trump's inauguration.
The numbers were in last week, and I know I'm running a little behind, but I'm here to tell you the number of people that opted to not have health insurance through the health insurance marketplace for the year 2026. The number is 4 million. 4 million people decided to cancel their insurance through the health insurance marketplace for 2026. We're looking at in 2025, we had from around 22 million people that were enrolled in the health insurance marketplace, and some of you I like to call it Obamacare, you see right here on my screen. So we're down to around 18 million people that canceled their insurance due to the enhanced tax subsidies expiring. What happens with the enhanced tax subsidies? When they expire, premiums spiked by 26%, and the deductibles, remember the deductible is what you pay, the deductible doubled. So it was deemed unaffordable, is what we once called it, the Affordable Care Act. So the Obamacare enrollment dropped sharply after the subsidies expired. And now, remember, when the enrollment drops, we have a drop in the amount of people we need working at the insurance company. Remember just a few days ago, my video about the Centene layoffs? And let us not forget about Cigna exiting the marketplace. We're seeing layoffs everywhere. Did this all start with the enhanced tax subsidies expiring? Could be. What's your thoughts? Leave a comment in my DM. But remember, 4 million people no longer have insurance, and I know those ERs are crowded. Hit my DM.
Okay, I just Googled. Can illegal people in the United States get, what did I say? Let me see what I said. Free healthcare in the United States if they are illegal. Emergency care is provided for all. Hospitals must treat and stabilize anyone who comes into an emergency room, regardless of citizenship or ability to pay.
That's emergency room. You're talking about health insurance.
I'm not done. I've told you that, though. If they would get hit in the street, they will be taken by ambulance. Who do you think pays for all of that? We do.
Hang on. Let me ask you this. What's the alternative? They should be left in the street to die?
No.
What do you propose we do about that?
We are caring for them already. Here's limited state or local programs. Yes. Some states and cities have their own programs that help illegals. California, New York, Illinois, Massachusetts, Oregon, and Washington State offer state-funded Medicaid to cover undocumented children and undocumented adults.
That's state funded. That's not federal.
These are state or county funded, not federal. You're right.
As you see, Obamacare is a total disaster. It's been a disaster. It's gone up through the roof. It's a total disaster. We want to spend the money. We want to give you the money directly. Buy your own health care. What's happening is these insurance companies taking billions and billions of dollars, and they don't give a damn about you. And you go out and you get crummy health care at a price that's unaffordable. So we want to give you the money, and you spend the money, and you go around and negotiate. You're going to have money left over, so much better, and you're going to have much better health care.
I just saw Hillary Clinton say that insurance premiums were going up for millions and millions of people because of that stupid big whatever act that was passed. I'm not sure I understand it. She said something about the ACA. He ended some credit that the insurance companies got for the ACA. And so insurance costs would be going up like 75% for millions of people. Is that possibly true?
Hi, girly. My name is Sarah. I'm a health economist. I study healthcare financing, including insurance, and I have the answer to your question. Also, for everyone who's watching this, please do not go into that woman's comments and harass her. This is for educational purposes. So, just so we're clear there. Now, I've made several videos, which you are happy to look back on why health insurance in the next year is going to be very expensive. There's actually several reasons. However, I want to go to the specific reason you mentioned about the Affordable Care Act subsidies. When the Affordable Care Act was passed, there were two measures that were meant to make the plans on the exchanges more affordable to enrollees. The first is the premium tax credit. And so when you enroll in an Affordable Care Act marketplace plan, you received a tax credit that would ultimately be applied in theory to your premium or what you pay every month for health insurance. The second is known as the cost sharing reduction. So when you actually use your health care or your health insurance, it decreases the amount of money necessary to pay down your deductible and other out-of-pocket costs. So when you actually go to use your health insurance, it's more affordable. Now, these subsidies were implemented in the original version of the law that was passed in 2010. Now, when former President Biden was elected in 2021, Congress passed something known as the American Rescue Plan. It was the first big budget bill meant to stimulate the economy during the COVID-19 pandemic. And in that bill, it included something known as the Enhanced Affordable Care Act subsidies. Essentially, because at that time, we were at an inflection point in the COVID-19 pandemic, there was an effort among lawmakers to make health insurance more attractive so that people would be incentivized to actually go to the doctor and treat themselves. What these enhanced subsidies did is it reduced the maximum amount that people had to pay for health insurance coverage on the Affordable Care Act exchanges, as well as make the plans available to more people by expanding the income limits for the enhanced subsidies. These subsidies were expanded additionally in the Inflation Reduction Act passed in 2022. Now, the subsidies in the Inflation Reduction Act are set to expire at the end of this year in 2025. And these enhanced subsidies were a pretty popular policy decision for Americans because the number of people receiving those subsidies has increased from 12 million people in 2021 to 1.4 million people in 2024. And the vast majority of people, around 75% of the people who receive those subsidies, make less than 250% of the federal poverty line, which is a little under $38,000 a year or less. Now, the reason why we bring up the One Big Beautiful Bill and why it's important is because it was a budget reconciliation bill. So with the enhanced subsidies expiring at the end of 2025, the One Big Beautiful Bill would have been the perfect mechanism for which Congress to do that. And there were a lot of debates about whether or not Congress should even do that. However, Congress chose not to enact the enhanced subsidies. Several lawmakers claimed that these enhanced subsidies were simply costing too much and a pandemic era policy that we should just discontinue. So because the One Big Beautiful Bill did not extend those enhanced subsidies, we are approaching what is essentially a subsidy cliff, if you will, which means that starting in 2026, we will go back to the previous subsidies that are less generous than the ones passed in 2021.
Starting on November 1st, around 24 million Americans are going to start shopping for health insurance on the Affordable Care Act exchanges for next year. The government is currently shut down as Congress fights over whether or not to extend funding that help people pay for that coverage. If they don't reach a deal, all of those people are in for some serious sticker shock. So the original Obamacare passed in 2010, and it set up this system of income-based subsidies to help people buy their own insurance.
Millions of people will get tax breaks to help them afford coverage, which represents the largest middle-class tax cut for health care in history.
But over the years, a lot of people who they thought would sign up for insurance didn't because it was too expensive. So during the pandemic, they extended these subsidies to lower the price of insurance for almost everyone who bought it.
This is considered one of the biggest things my administration can do, lower cost and expand coverage.
And then what happened was the enrollment started skyrocketing. It's basically doubled. Ironically, a lot of the new enrollment did not occur in states that Democrats govern. It happened in places that we think of as being more Republican. Signups have more than tripled in a bunch of southern states. These are places where there were a lot of low-income people who worked in the kind of jobs that didn't offer them insurance. They are also states that decided not to expand Medicaid under Obamacare, and so that meant that those low-income people didn't have access to any other kind of government program to provide their insurance. If the subsidies don't get extended, on average, the amount people are going to pay for their insurance is going to double. But under the hood of that kind of average increase, there's actually quite a lot of variation. For really low-income people, imagine someone making about $22,000 a year. That person doesn't pay anything towards their insurance now. If the subsidies expire, that person will have to pay $66 a month. For someone earning around $35,000 a year, their premium will go up by $132. And for an older person who's making a little more, say around $65,000, their premiums are going to go up from a couple $100 a month to maybe as much as a couple $1,000s in the most expensive markets. Even though a lot of Republicans continue to dislike Obamacare, they have also come to realize that this is a policy that benefits a lot of the people they represent. There are quite a lot of Republican lawmakers who have publicly acknowledged that they would really like to have a solution to this problem to prevent their constituents from losing affordable health insurance. And I think that's why Democrats have chosen this issue. And I also think it's why there is a chance that there could be a bipartisan deal to extend this funding.
Say you are in a critical thinking class and you're obviously failing it. Then in the fourth quarter of the class, you do a little bit of extra credit and you improve your grade from an F to a D. You get your report card at the end of the year and the teacher says you got a D. And you go, I should have never done that extra credit. You don't blame the little improvement for the reason why it's bad in the first place. Obamacare is a set of pretty basic regulations. It is not a healthcare system. Obamacare just said no more pre-existing conditions clauses. It said you can't charge people more because of their genitalia. It said no more policy maximums, which says that the policy doesn't have to pay anymore if you're too sick, along with a couple of other very basic regulations that made it so that people couldn't just be denied coverage because they were unlucky. And they balanced that out with a requirement that everybody has to be covered. It's the only way that insurance can actually work. Now, I know whiny McDrunky Pants turned this video off like 45 seconds ago, but in the off chance that any other MAGAs are still here, congratulations, I love you, and I hope you have access to healthcare.
Who remembers before Obamacare was mandated that healthcare was actually affordable and it actually covered 80% of things? It was really good. Who remembers that? Anybody else?
Hello guys, and thanks for watching this far. I really appreciate. So you've seen these street interview clips where someone says, I hate Obamacare, but thank God for the Affordable Care Act. It's easy to laugh at it, but when you step back, it's actually a pretty terrifying how well political marketing works. Think about how wild that is. You can take a set of healthcare policies, things like letting your kids stay on your plan until they are 26 years, or making sure insurance companies can't drop you if you get sick. And people love those things. But the moment you attach a specific politician's name on it, half the country suddenly thinks it's government takeover designed to ruin their lives. That isn't an accident. In modern politics, the actual content of a law barely matters compared to how it gets packaged. If you sell a policy on its merits, people usually want basic safety net. But if you frame it as us versus them, people will literally vote against their own medical coverage just to feel like their team won. This whole situation points to a massive problem we don't talk about enough. Most people have zero ideas how their own governments work. We live in a soundbite culture. Most people don't read the bill. They don't look at the policy breakdowns. They watch 15-second clip on their feeds, pick up a narrative and run with it. When a media outlet or a political tells them this bad law is ruining America, they internalize it without taking 2 minutes to check if the law is the exact thing that keeps their own family insured. And let's be honest, it's driven by tribalism. When politics become an identity instead of a tool to improve society, people stop asking, does this help me? And start to ask, who made this? If their guy made it, it's evil. If our guy made it, it's a blessing. That mindset turns real life into a team sport. Expect the trophy at the end of higher bills and worse healthcare. With the enhanced subsidies expiring, millions of families are suddenly seeing their monthly premiums jump by double-digit percentage. When the cost goes up, people do the only thing they can when you're broke. They drop coverage, and suddenly 4 million people are floating around with zero safety nets. And look at the domino effect. It doesn't just hurt the people who loses their insurance. When millions of people drop off their roll, insurance companies lose revenue. What do companies do when revenue drops? They cut costs. They offer voluntary buyouts. They start laying off staff, and the corporate healthcare market takes a hit. It turns out healthcare isn't just a political talking point, it's a massive sector of the economy. When you mess with the funding structure to make a political point, the fallout hits real people, from the family trying to afford insulin to the administrative work at an insurance firm getting laid off. For years, people voted for politicians who promised to roll back these exact subsidies and protections. They cheered at rallies when leaders promised to dismantle the system. But now, when these rollbacks actually happen and the subsidies fade out, the same voters are shocked that their own bills went up. It's sad to watch. On one hand, you want to feel empathy because nobody deserves to suffer from lack of healthcare or financial distress. On the other hand, there's a brutal reality here. Cause and effective exist. You cannot consistently vote for policies that strip away public safety net and then be surprised when the safety net isn't there to catch you when you fall. We're watching a real-time lesson in what happens when voters prioritize political spite over practical self-interest. You can win a political argument on Twitter, but Twitter isn't going to pay your $800 monthly premium. At the end of the day, healthcare shouldn't be about partisan branding or red versus blue messaging. A doctor doesn't ask who you voted for before treating you in an emergency room, and the medical bill doesn't care about your political affiliation. Until we, as a public, start evaluating policies based on what they actually do, instead of who proposed them or what slogan got slapped on the box, we're going to keep running in the same wall. If you take anything away from this, let it be this. Always read the fine print. Don't let a catchy name or a political brand trick you into throwing away something you actually need. And now, family, we've come to the end of our commentary today. And I want to open this platform to all of you to share your thoughts on what you think about this video. Don't forget to subscribe, to like, and to share this video to your friends. Until next time, I'll see you in the next video.
Thank you for staying tuned. A surprising political debate has gone viral after some white Americans say they were shocked to learn that Affordable Care Act or ACA is actually the same health care law commonly known as Obamacare. For years, many people refer to the law by different names, and surveys have shown that some Americans view ACA and Obamacare differently, even though they are the same legislation. The Affordable Care Act, signed into law in 2010, expanded access to health insurance, protected people with pre-existing medical conditions, and introduced health insurance marketplaces. While supporters argue it helped millions get coverage, critics have long debated its cost and effectiveness. The renewed online discussion has sparked conversation about how political messaging and terminology can shape public opinion. It also highlights the importance of understanding policy before forming strong opinion about them. Now, the healthcare was taken away by Trump administration. As healthcare remains one of the biggest issues in American politics today, debate over the HCA are likely to continue for years to come because Donald Trump has stripped away the Obamacare for everyone. If you enjoyed this analysis, don't forget to hit the like button, subscribe to the channel, and turn on the notification bell for more political insight, updates, and current affairs about America.